So there have been a number of pieces of legislation that have come through South Carolina that continue to get pushed back. These things that would limit women's reproductive health choices and access, and they've continued to get pushed back through strident efforts through a number of different organizations, and frankly through some of the very, very dedicated senators and other legislators that exist right now in the House and in the Senate. And if that were to happen, the case would have to go before the Supreme Court and it would have to be overturned. And then it would basically get bumped back down to a state level access and choice. And what that would mean is that if South Carolina did make it a choice so that it limited women's reproductive choices and access, then women in South Carolina would have to go to other places to have those choices made. And I think that that adds an added hardship, both medically, financially, economically, to women. And as an OB-GYN, I know that there will be a number of people that will do everything that they can to protect women's choices. It will be a rocky road for women, but I think that, like I said, I think that there are a number of people in place that will do everything that they can to maintain women's reproductive health. I mean, for me, public health is a really important topic in the way that it affects our legislation and the way it affects our communities, because I see these things as overlapping priorities, and the pandemic is brought that to, I think, into light for everybody to recognize that public health is not siloed off by itself, that it's actually an integral part of our communities. And seeing things through a public health lens and recognizing how these things, the choices that we make in Columbia, affect the everyday lives of people in our districts is really important. Because one of the other things that we probably didn't even mention in this is, the topic of environment and how environment affects the public health in South Carolina. Because we have a beautiful state, we have a great tourist economy, we have a beautiful coastline, we have beautiful mountains up here in the upstate, and we want to make sure that we are protecting those both as natural resources from an economical standpoint, but from the public health standpoint as well, because we know that without protecting those things, that it dramatically affects the public health of the people that live in those communities. And I think having those conversations on that basis and talking about the overall need to take care of our climate and our environment are big things, because we see what's happening in other states where they've had issues with just crazy natural disasters, and we want to make sure that that is not one of the public health crises like that comes to South Carolina. I said, what do we not know about it? For sure, we know more about public health than people who are there. We live it, we work it every day with patients and have these patient stories that we can draw from, and we see how these choices affect people on a regular basis. I said, but then again, we also are the same people that pay taxes, drive on these roads, send our kids to public schools. We have a very similar basis of knowledge. The thing that we have that is different is we have this lens that we see things through that is a public health lens. And as a physician who is very interested in public policy and seeing our outcomes in South Carolina improve, looking at things with a public health lens, I think would be a very useful part of the conversation in the legislature.